Hi, I'm Awodoye at Maife, your anchor at Health Issues and Awareness, where I discuss about health problems and challenges. Today, I would like to really appreciate those who took their time to like, share, and subscribe to my YouTube channel. Most encouraging are the messages I receive from home and abroad, where they actually want me to do something I mentioned in my last video, living healthy, which I'm going to be doing today. But before the discussion, I would like to enlighten us on this video I do on infections or diseases. Is a brief explanation. As we all know, not everybody can be on the medical line, so those who are not on the medical line need to know what is actually wrong in the body and the right step to take in preventing sickness or preventing from them from being sick. So this is to enlighten us on what actually goes on wrong in the body. So today I'm going to be discussing about pneumonia. So pneumonia is an infection of the air sac, which is also known as the alveoli of the lungs, in which the alveoli is filled with fluid and pores, thereby making breathing very difficult. We have the numerous causes, but I'll mention few. We have the bacterial cause, which can either be staphylococcus or streptococci. Then we have the fungi, then we have the virus, which also can be Middle East respiratory syndrome, also known as coronavirus. Then we have exposure to excess cold. That is why we need to dress properly in cold season. We need to dress properly in cold season and take warm water, not cold ice block water. So we need to dress properly. Then there are signs and symptoms. There are numerous also, but I will mention few. There is fever, there is headache, there is nausea or vomiting, there can be loss of appetite, there can be chest pain, there can be cough, then there can be difficulty in breathing, there can be fatigue. So as we all know, most of all these infections have these similar signs and symptoms, so we don't know which one is which one. That is why we need to visit our health center for proper diagnosis. That is why we need to visit our health center for proper checkup and diagnosis of what is actually wrong. Then yes, infections can be the pneumonia infection can be very contagious, because it is an airborne droplet from cough and sneezing, and or from contaminated surface or object. So that is why we need to be careful. We still need to take the necessary precautions by washing our hands regularly, by using our face masks, as some of us are not using our face masks right. You see some people, they will use it to cover their mouth alone and their chin, or you see some people, they will put it at their chin. It is meant to cover your nose and your mouth. Then the face shield is meant to be used with your face mask. Then you need to maintain your social distance so that you don't get infected. So those are the signs and symptoms I mentioned earlier. Now I will discuss about the types of pneumonia. The types of pneumonia is also known as where one can acquire pneumonia. Just as the name implies, that is where one can acquire pneumonia. We have the hospital acquired pneumonia, acquired in the hospital environment. Then we have the community acquired pneumonia. Here in this community, you get it through an infected person or through exposure to cold or some chemical substances in the community. So that is why you need to be very careful. Then we have the ventilator pneumonia due to ventilator associated pneumonia due to prolonged use of ventilator or NG tube. Then we have the aspiration pneumonia. This is when one inhale the bacteria from food, drink, or saliva into the lungs. So you need to be very careful. Then there are stages based on the area it's affecting. We have one, the bronchopneumonia, Here, this is when the infection is close to the area of the bronchi or like the windpipe. This is called bronchopneumonia. Then we have the lobular pneumonia. In lobular pneumonia, what happens is that one lobes of the lung is affected. As we all know, there are so many lobes in the lungs. So this is what happened in lobular pneumonia. Then in lobar pneumonia, this is where one or more or the entire lobes of the lungs is affected. And in lobar pneumonia is also divided into 4 stages based on its progression. Then we have congestion. That's stage 1. We have congestion, and what happens in congestion is that the air sac is filled with pus and fluid. Then that is congestion, thereby making breathing very difficult. Then in stage 2, we have red hepatization. What's happening in red hepatization? This is where there is movement of red blood cells and immune cells to the area of infection in the lungs, so thereby making the lungs appear red and solid in appearance. Then we have gray hepatization. What happened in gray hepatization? This is the 3rd stage. What happened here is that the red blood cells are destroyed and the immune cells remain, thereby the lungs appear gray in color. Then in resolution, which is the 4th stage, is that the immune cells evacuate the infections from the lungs, and a productive cough will help in remove fluid from the lungs. So that is why we need to boost our immunity. We need to eat food that will help boost our immunity, as our immunity help fight against infections. As we all know, antibiotics cannot cure a viral infection. Some of them dissolve on their own. So when you eat adequate balanced diet or nutritious food, you can help in building up your immunity. Then our fruits and our vegetables should be washed and cooked properly before we consume them. If this is not done, there are also ways that you can prevent by eating nutritious food, like I said earlier, by immunizing ourselves. Then in cold period, let's wear proper clothes to prevent us from acquiring pneumonia. Let's wear proper clothes, put on proper clothes to prevent excessive cold. Then when these things are not done, there can be complications, can lead to serious complications, and pneumonia is a life-threatening infection that we need to be very, very careful of. We need to be very, very careful of it. It can be life-threatening. And what are these complications? There can be atelectasis. This is collapse of the lungs. Then there can be bacteremia. This is when the infection has gone into the bloodstream, which can go to anywhere. Then there can be septicemia. This is when the infection has gone through the whole body. It has gone through to the whole part of the body. Then there can be empyema. Empyema is when the lungs is filled with pus. So we see the dangers of pneumonia. These are some of the dangers of pneumonia. This is all what I have for you on health issues and awareness. I would like you to click on the like button and share, and also subscribe to my YouTube channel. Thanks.